Is private practice right for you? Essential considerations for physicians. In this video, we're going to be talking about whether being a part owner of your practice or being the sole owner of your practice is right for you. There's going to be pros and cons to this decision, and we'll go over that in just a few minutes. Before we go into that, I'd like to go over the historical trends that we've been seeing in terms of practice ownership. As you can see here, in the 1980s, about 76% of physicians were owners of their practice. But this percentage has decreased over the years. And now it's actually a minority of physicians own their practice. More physicians are choosing to be employees. And we're going to go over why that might be, some of the risks and benefits that are associated with owning your own practice. Well, the elephant in the room is that physicians, we don't have any business courses in medical school, and most of our undergraduate degrees are going to be science related and without any business courses. Many times physicians are not interested in business. That's why they went into medicine, or they might feel ill-equipped to run a business, a successful business, and not want to deal with all the hassles of having to run a business. So I think that might be part of the reason that there's fewer physicians, but it's always been the case that physicians don't have a special training in business, but the demands on a medical practice may have increased in terms of administrative requirements and legal stuff. So that might be part of the reason. Also, physicians, even though we can be excellent at what we do in terms of practicing medicine, we might not have skills that are needed to run a successful practice. Just because we're really good at being, let's say, a neurologist or a surgeon, doesn't mean that we're really good at running a business that delivers those services. And sometimes, because we're really good at what we do in terms of our specialty, and that we've done well in school over the years, so we could get into medical school and into our specialty, that confidence can be damaging if we apply it to running a business if we haven't done the work of learning how to run a successful business. Now, let's go over some of the pros about joining a private practice and owning your practice. And full disclosure, I am a part owner of my practice. Actually, I'm the full owner right now of my practice. So I am biased in terms of that's the way I chose to go. And so, but I understand that this is not for everybody, and that people may have different interests and may not want to deal with all the hassles of running a business. Now, the main benefit for me in terms of owning your practice or being part owner of your practice is that you have the autonomy. You have more control over all the decisions related to how the practice is run. Whether your patient schedule, you can see patients in 30 minutes or 1 hour or whatever you think is appropriate, and you can schedule them whenever you feel is better for you. And you won't have that much flexibility in terms of scheduling decisions if you're an employee for a big medical group or a hospital. And then treatment decisions are going to be really up to you, since you won't have pressures from administration that you have to make decisions based on formulary or other limitations that can be imposed by the hospital or big medical groups. You have the autonomy to influence the systems that get applied in your practice and how they're implemented. And to me, that's huge. As you know from our website, Lean Physician, I'm very big into lean methodology and applying that to medical practice and training our staff in lean methodology. And I'm very diligent about that. And that's something that would be very limited if I was an employee. I wouldn't be able to set up my own systems, or if I did, I would have to do a lot of convincing of administrators and other physicians and to be able to do that. So being able to set your own systems and optimize them, you can have a lot more autonomy if you are the owner of your practice. And then management decisions. Of course, as a physician, you want to be more of a leadership type of role, but you can also play, when interested or up to the point that you're interested in getting involved in some management decisions, or at least selecting the managers that will be taking care of the management decisions. I believe when you have your own practice and you own your practice, you get to have a stronger relationship with your patients, because the whole practice is directly influenced by you, so it's a lot more personal, and you can tailor it to satisfy the needs of your patient population. And so for that reason, I believe you can get a closer relationship and with your patients. Plus, you can influence more the amount of time you spend with patients and the way you spend that time. Make it more high quality, high value time by implementing lean methodology, as we teach you in leanphysician.com. Now, of course, you have more flexibility because you have the autonomy to control things. And so there's more flexibility in terms of the working hours. If you want to work 4 days a week or 5 days a week or half days or weekends or not work certain days, you have the flexibility to do that. You get to make those decisions. And that means that you have a more control over your work-life balance. Lower overhead. Why do I say lower overhead? Well, when you own your practice and you're practicing in your own practice, you are gonna have more control over the overhead. And since the overhead is gonna have a more direct influence in what you bring home in terms of earnings, you're gonna be a lot more interested in keeping that under control. And so in general, I think if you're the owner of your practice, you're gonna have lower overhead because you're gonna have a more watchful eye on those expenses and try to limit them. Physicians, if you're the owner of your practice, you're going to have more shared decision making. You're going to have more control over how you run that practice, as we discussed earlier in the systems and the scheduling and all that. And also in the big picture decisions for the practice, like strategic business decisions for the practice. If you're going to grow it, if you're going to move, if you're going to expand, if you're going to deliver certain services, you're going to have a lot more control over those decisions. Now let's go over some of the cons of owning your own private practice. And I want to be fair and balanced, and there's many positives which to me outweigh the cons, but we definitely have to look at the cons because this is not for everybody. Financial risk. You're running a business. You're not just an employee in a business, but you're actually running the business. So it's up to you for the business to be successful. And running a business is difficult, and there could be more fluctuations in your income. There could be a pandemic that comes along, and then everybody's afraid to go to the doctor, and then your patient visits drop and your income drops, but then your expenses are still there. It can be very stressful dealing with a medical crisis like that, like a pandemic. And so that's definitely a con of being the actual owner of the business. You're also more exposed to the consequences of cyber fraud. Cyber fraud, has become a big deal, and it's definitely in medical practices are definitely targeted. And if you're part of a big hospital group, they probably have designated people that are in charge of mitigating that risk and having all the safety precautions, and they have an IT department, and they have the insurance in case you're the victim of that. That's less likely if you have your own practice, and then you have less resources to IT and designated people to do that. So that could be a big con of being the owner of that practice. You have more administrative responsibilities. You can't just focus on your specialty and delivering medical care. You also have to worry about, are you running a successful business? Are you ensuring that your practice reputation is good? That you have to worry about hiring enough staff and management people. You have to also, keep an eye on the morale of your practice. Make sure your employees are happy working in your practice so that they can give good service to your patients. That all becomes your responsibility when you own a private practice. And you can have sometimes limited resources. As I mentioned earlier, you probably won't have a full IT department and watching out for cyber attacks or addressing any IT issues that come up, and other, you won't have a human resources department. So there's going to be more people wearing different hats and doing different tasks than if you were working for a hospital or a big medical group. But also you're going to have less overhead and more earning potential. Isolation, and this can definitely be mitigated. If you get your own private practice, then you might be isolated to just the people you're working with and not get to interact as much with other physicians and other specialists, other professionals like pharmacists and nurses and all that. But that's not necessarily the case. You can always do these in the hospital, like call duties in the hospital, which will let you interact and network with other physicians and other specialists. So that's very easily fixed if that's a concern. So you have to, of course, be more proactive, creating networking and creating relationships with other specialists. And you're going to have limited specialty services, but again, this can also be mitigated by being in close proximity to the hospital or going to the hospital and getting to know what are other specialists in the area that you can refer to, where they can send your patients for different procedures that they might need. And so that's definitely can be mitigated by being close to the hospital and having relationships with the hospital and doing hospital and call duties. So ultimately, it's a very personal decision and it's not for everyone. There's definitely the pros and cons as we just covered, and it's based on your individual preferences and also your strengths. What are you good at? And also what are your career goals and priorities for your life and also for your business and your professional development. And also it can be affected by the specific circumstances of your life and also the community where you plan to practice and what is available, what is the competition, what are the needs. That also influences how you want to proceed in terms of becoming an employee or owning your own business. So overall, as we discussed, it's going to be weighing the benefits of what you get with being an employee, which is the stability and resources of a hospital or a big medical group, versus the main benefits of owning your own private practice, which are the autonomy and the potential for higher earning. Whenever you take more risk, there's always more potential earnings or income. If you enjoyed this video, please like and subscribe. Also share it with any friends who might find it helpful. Please leave me any ideas for future videos. I'll be trying to post new videos every single week. Take care.